Each time you enter the client's space, you must tell them why you are there and which medications they are about to take. You must identify that you have the right client. When administering pills, encourage the client to drink a significant amount of liquids. You must check to see that the client took their medications before you leave. Look into the client's mouth to make certain they swallowed them and are not hiding the pills to avoid taking them. According to the MAR, this particular pill requires crushing. There are several ways to crush a pill, and the technique may vary from agency to agency. Some methods involve using a mortar and pestle. One method is to crush the pill in a paper medication cup. In order to contain the medication in the cup, place a second paper cup on top of the pill. Place the stacked cups inside the mortar and use the pestle to crush the pill into a fine powder. Another way to crush pills is with a levered pill crushing device. Again, place the pill between two paper medication cups. You usually need to hammer the pill several times before the pill is crushed into a fine powder. If the medication comes in an individual package, you can leave it unopened and place the package in the mortar. Use the pestle to crush the pill into a fine powder. You can then open the package and pour the powder from the package. The least preferred way of crushing a pill is to place the pill in a clean mortar and use the pestle to crush the pill directly. You will need to use a clean tongue blade to scrape the medication powder from the mortar into the medication cup. The problem with this method is that you lose some of the medication because it adheres to the surface of the mortar and pestle. You must also clean the mortar and pestle before returning them to their storage place. Once the pill is crushed into a fine powder, you can mix it with applesauce or pudding. Use only a small amount of food product because the mixture will taste bitter and it is necessary for the client to eat the entire portion. Always remember to date the food container according to your agency's policy. Some medications require mixing before administering. Metamucil is one example and can be mixed with water or juice. Empty the pre-measured amount of Metamucil into the juice. When using a straw to stir, tear the paper wrapping from the straw so that your hand does not touch the portion of the straw going into the cup or into the client's mouth. Note that Metamucil will turn to gel if it sits too long, so it needs to be given shortly after mixing. Before taking the medications to the client's room, mark your place in the MAR, close the book, and lock the cart. Always introduce yourself when you enter the client's living space. Check that you have the right client. Tell the client why you are there and what medications you are giving them. Unless the MAR indicates a specific sequence, the client can choose which medication to take first. Stay with the client and watch to make sure they take all of their medications. When the client is finished, return immediately to the MAR and document that the medications have been given. Remember to practice good hand hygiene before and after medication administration. If your hands are not visibly soiled, you may cleanse your hands with an alcohol-based hand gel between clients. Always provide the right documentation in the correct space on the MAR after each client has received their medication to avoid errors. When pouring liquid medications, pour them at eye level to get a more accurate measurement. After pouring, set the measuring cup on a level surface to double check you have poured the right dose. If you accidentally pour too much into the medicine cup, simply pour small amounts out into another cup until you get the correct dosage. Never pour liquid medication back into the bottle to prevent contaminating the remaining medication. Remember to perform the 3 checks to avoid giving your client the wrong medication. Always keep the medication cart securely locked when you leave. Before taking the medications to the client's room, mark your place in the MAR. Remember to pour a cup of water for the client to drink with their medications. Identify that you have the right client and tell them why you are there. Sometimes clients find it helpful to wet their mouth with water before taking liquid medications. When you have finished giving medications, cleanse your hands with hand gel or by washing them. Gather the supplies that need to be refrigerated and return them to the refrigerator. Move the locked cart to the agency's designated storage place. Most agencies require the locked cart to remain in a locked storage room to keep it secure when it is not in use. Many liquid medications come with droppers to provide accurate measurement of the medication. It is important to use the dropper that comes packaged with the medication to be sure you give the right dose. When you open the package, remove the lid from the bottle and insert the dropper. Throw away the lid and leave the dropper in the bottle for later use. To get the right dose into the dropper, pull the dropper out of the bottle far enough to see the marked measurements. Squeeze the bulb on top of the dropper and slowly release the pressure. Keep the same amount of pressure on the bulb and move the dropper over the medication cup. Squeeze the bulb completely to dispense the medication into the medication cup. When liquid medications do not come with the dropper, you will use a metered medication cup to get the right dose. In order to assure accurate dosing, if the amount to be given is less than 5 cc's, you will use a syringe. Oral syringes are designed with an off-center tip to administer liquid medications to children and adult clients who cannot drink from a medication cup. The off-center tip identifies these as oral syringes as opposed to injection syringes. Some agencies use a special stopper designed with a hole in the center. This allows you to insert the tip of the syringe into the stopper to make it easier to draw up the right dose. This stopper can also be left on the bottle in place of the cap. If you do not have a stopper, you can pour the approximate amount into a medication cup and draw it up into the syringe from the cup. After inserting the oral syringe, invert the bottle and withdraw the exact amount of medication listed on the MAR. Turn the bottle upright and withdraw the syringe. Close the stopper on the bottle and return the medication to its storage place. Always perform the 6 rites of medication administration. When administering oral medications to a client who is a child, always put on clean gloves because you may come in contact with saliva. At this point, you will perform the first of the 3 medication checks. Check the MAR for the right client, the right medication, the right dose, the right route, and the right time. Explain to the parent or guardian how you will administer the medication so they can understand and assist you. Giving medication to a child is easier if the parent or guardian holds them. Gently hold the child's chin and slowly inject the medication along the side of the mouth between the gums and the cheek, which prevents the child from choking and from spitting out the medication. Allow the child time to swallow and gently squeeze in more of the medication. Take a few minutes to offer comfort to the child when you are finished. Buccal medications are oral medications that are designed to be dissolved in the mouth. They are not to be swallowed whole. Buccal medications are placed between the cheek and the gum on either side of the mouth. They dissolve quickly and get into the bloodstream for an immediate effect. Always introduce yourself when you enter the client's living space. Identify that they are the right client and tell them why you are there. Buccal medication is absorbed better when the mouth is wet. Ask the client to drink some water before placing the medication in their mouth. Because you may come in contact with saliva, always put on clean gloves before administering the medication. Place the tablet along the side of the cheek, between the cheek and the gum. Instruct the client to neither chew nor swallow the pill, but to let it dissolve. Tell them they are not to eat, drink, or smoke until the medication is completely dissolved. When you are finished, remove your gloves and wash your hands. Sublingual medications are oral medications that are designed to be dissolved in the mouth. They should not be swallowed whole. Sublingual medications are placed under the tongue, where they dissolve quickly, getting into the bloodstream for an immediate effect. Always identify that you have the right client. This time, the identification method used compares the picture on the MAR with the client. Always perform the 6 rites of medication administration. For some medications, you may need to take the bottle with you to the client's side. If the client is able to assist, tell them to place the tablet under their tongue. If the client is not able to assist with placement of the tablet, put on gloves and place it under their tongue for them. Instruct the client to neither chew nor swallow the pill, but to let it dissolve. Tell them they are not to eat, drink, or smoke until the medication is completely dissolved. If your client is having chest pain, stay with them until the pill is dissolved and the pain has gone. Your presence can be calming and reassuring. Please pause for review and practice. Eye medications are used to treat inflammation and infection. Check the MAR to determine which medication is to be given and which eye, or if both eyes, are to be treated. Always introduce yourself when you enter the client's living space. Because you may come in contact with tears, always put on clean gloves before administering the medication. It is important to wash your hands before and after administering eye medication. Remove the lid from the eye drop bottle and lay it on a clean surface. It is very important to not let the tip of the dropper touch the client's eye or eyelashes, nor your hands or fingers. This will prevent possible injury and the risk of getting germs on the dropper. Tell the client to gently tilt their head back and to look up and away. With the client's permission, gently pull down the lower eyelid. This will create a pocket for the drops. Drop the exact number of drops listed on the MAR into the eyelid pocket. After administering the drops, gently press the corner of the eye at the bridge of the nose for 1 minute. This will prevent the medication from draining into the mouth. In order to spread the medication completely over the eyes, ask the client to gently close their eyelids and roll their eyes around. When you are finished, remove your gloves and wash your hands. Applying eye ointment is similar to applying eye drops. Tell the client to gently tilt their head back and to look up and away. Remember not to let the tip of the tube touch the client's eye or eyelashes, nor your fingers or hands. With the client's permission, gently pull down the lower eyelid. Spread an even ribbon or line of ointment into the pocket. Ask the client to gently close their eyelids and roll their eyes to evenly spread the medication. Because it is common for the client's vision to be blurred after eye ointment medication, tell the client to remain sitting for 10 minutes following treatment. This will prevent them from falling or having an accident while walking with blurred vision. Please pause for review and practice. Ear medications are used to treat inflammation and infection. Check the MAR to determine which medication is to be given and which ear, or if both ears, are to be treated. Always introduce yourself when you enter the client's living space. Because you may come in contact with ear drainage, always put on clean gloves before administering the medication. To avoid injury and to prevent getting germs on the dropper, it is very important to not let the tip of the dropper touch the client's ear or hair, nor your fingers or hands. Tell the client to gently tilt their head to the non-affected side. Because the adult ear canal is in the shape of an S, you must straighten it to allow the medication to enter the canal. To do this, gently pull the ear up and back. Drop the exact number of eardrops listed on the MAR into the correct ear canal. Encourage the client to keep their head tilted for 2 minutes to allow the medication to enter the ear. The ear canal points upward in infants and children up to 3 years of age. To straighten the canal in a child this age, you must gently pull the ear down and back before administering the drops. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. Nasal medications are used to treat inflammation and infection or to deliver other medications. Check the MAR to determine which medication is to be given and which nostril, or if both nostrils are to be treated. Always introduce yourself when you enter the client's living space. Because you may come in contact with mucus from the nose, always put on clean gloves before administering the medication. Give the client a tissue and have one ready for use after administering the medication. To avoid injury and to prevent getting germs on the dropper, it is very important to not let the tip of the dropper touch the client's nose nor your fingers or hands. Ask the client to gently rest their head back on the chair, being careful that they do not strain their neck. Drop the exact number of drops listed on the MAR into the correct nostril or nostrils. Because the client has breathed on the dropper, it is important to wipe it off with a tissue prior to returning it to the bottle. Once used, this bottle of nose drops can only be used by the same client. When you are finished, remove your gloves and wash your hands. Administering nasal spray is similar to administering nose drops. Give the client a tissue and have one ready for use after administering the medication. When administering nasal sprays, ask the client to insert the bottle into one nostril and block the other nostril by pushing against it with their finger. Instruct them to inhale through their nose while squeezing the bottle. Make sure the client inhales the correct number of sprays listed on the MAR. Because the client has had the nozzle in their nose, it is important to wipe it off with a tissue prior to recapping. Once used, this nasal spray bottle can only be used by the same client. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. Inhalant medications treat diseases that affect the lungs, and they are only effective when they reach the lungs. The most common method for administering inhalant medications is through the use of metered dose inhalers. The type of inhaler and the right dose will be designated on the MAR. If more than one metered dose inhalant is needed, the sequence and the number of puffs for each will be indicated on the MAR. Always introduce yourself when you enter the client's living space. Check that you have the right inhalant medication by gently sliding the medication canisters